and today our lecture basically will talk on inguinal canal. And inguinal canal is an important anatomy because of how it correlates with the pathology and pathogenesis of inguinal hernias and the surgical treatment of hernias largely depends on the knowledge of the anatomy of the inguinal canal. So this is a very important topic of anatomy for surgeons, because without having a good grasp of the knowledge of the anatomy of the inguinal canal, doing herniorrhaphy properly might be a challenging task. So don't think it's just a canal that has two openings like a cylinder. No, the openings are oriented obliquely. Now look at how the content passes. What is the content of this canal? The spermatic cord. You see how it enters the canal from the deep ring, take an oblique course, coming out through the superficial ring. Difference between these two definitions, okay? Mid-inguinal point and midpoint of the inguinal ligaments. And their clinical significance. So what is the difference between mid-inguinal point and midpoint of the inguinal ligament and their clinical significance? Okay, let's see the difference. When you say mid-inguinal point, okay, this is the abdomen. Let's assume this is the anterior superior iliac spine. And this is the pubic symphysis. So, anterior superior iliac spine, pubic symphysis. So midway between the anterior superior iliac spine, midway between anterior superior iliac spine and pubic symphysis, a role in storage. So what the testis does is production of sperm. What the epididymis does is storage of the sperm. Okay? Now, it is important to know some certain few points about its anatomy because of your MCQs. The testis is located within the scrotum, of course, with the epididymis situated on the posterior lateral aspect of each testicles. Now look at this point. You should know commonly the left testis. The left testicles lies lower than the right. They are suspended from the abdomen by the spermatic cord. We just finished describing the inguinal canal and the spermatic cord and its content. So it suspends down into the scrotum, carrying the testis. So it transmits neurovascular bundles to the testis. Understand the chronology of the descent. At the 3rd month of development, the testis is in the iliac fossa. If there is arrest at the 3rd month by failure of contraction of the gubernaculum, because as the gubernaculum extends from here, it contracts and brings it down. So when there is failure, it's arrest. 7th month, where is it? At the deep inguinal ring. At the 8th month, the superficial inguinal ring. At the 9th month, the upper part of the scrotum at birth is in the lower part of the scrotum. Testosterone. Leydig cells are located in the interstitium. Don't forget. You will come across that in your MCQs. Where are the Sertoli cells? Any question? You can unmute yourself and ask. So thank you very much. If you have any question, yes, you can go ahead and ask your question.
Good evening, sir. This is Dr. Bello. I have one question actually.
Okay.
About the hydrocele that we just discussed. You said if there's a patent ductus vaginalis, then there would be fluid leaking into.
Yes.
There would be fluid leaking and causing a hydrocele, right?
Yes.